So, Jai Shri Krishna, a very warm welcome from Women to Women back to our low carb. As it was our Diwali, so Sal Mubarak to everybody, and well, Happy New Year to everybody. Jai Jitendra, Jai Swami Narayan. We shall start off with Omkara and then hand it over to Caroline for our big subject of microbiome. So that is quite exciting. I'm looking forward to know what it's all about. Anyway, let's see. Swaha Tatsaviturvarenyam Bhargo Devasya Dhimai Dhiyo Yona Prachodayat Om Bhurbhuvah Swaha Tatsaviturvarenyam Bhargo Devasya Dhimai Dhiyo Yona Prachodayat Om Bhurbhuvah Swaha Tatsaviturvarenyam Bhargo Devasya Dhimai Dhiyo Yona Prachodayat Dhiyo Yona Prachodayat Dhiyo Yona Prachodayat. Once again, Sal Mubarak to everybody. Can I welcome Caroline, please? And I'm sure whatever the subject today is going to help us reduce for all the Diwali food we had, all the gugras and the sweet stuff. So let's see what Caroline can do for us.
Oh, thank you very much. As always, thank you for organising this panel, and Happy New Year to all of you. And yes, you've probably done your microbiomes no good at all if you've been celebrating, but it's a huge, huge subject. And obviously it goes hand in hand with what we're talking about here in this group, really, which is about eating real healthy food that is going to help our bodies to be as fit, both physically and mentally as can be. So I'll just go on to screen sharing. Going to slideshow. Here we go. So hopefully you can see all of this. Microbiome is a massive subject, and I'm only really starting to get my own head around it. So this is going to be a very quick overview. It's becoming very, should you say, much better understood and much better written up in both public and medical sort of journals and publications. As always, there's lots and lots that you can find out about it on the internet. So I hope I'll just whet your appetite tonight. As always, I'll just start with a disclaimer. And I know our group tends to be called the low carb group, but really what we'd like to emphasize is we're the real food group, you know, talking about real healthy food. I thought my disclaimer was coming next, so I've gone past it. No, I've obviously got the slides in the wrong order. There it is. As always, I'm here just to share information with you. I'm not here to give you medical advice. And if you are on medication, particularly for diabetes and blood pressure, and you're going to make any major changes to your diet, then it is always worth talking it over with your GP or practice nurse, and perhaps getting them to do some regular checks to see whether your medication will need to be altered as a result of the changes you make. But anyway, on with tonight. So the gut microbiome. Why am I going to be talking about this? Well, we are starting to learn more and more and more, but actually it's not new, like everything under the sun. We've been here before. 2,500 years ago, Hippocrates, who's deemed to be the father of modern medicine, and talked about food be thy medicine, let medicine be thy food. He also pronounced that all disease begins in the gut, and we are slowly now coming round to understanding that he was absolutely right. And I find it fascinating that an awful lot of early medics who didn't have microscopes and didn't have the luxury of the kind of scientific education that an awful lot of our current medical professions have, had a, pardon the pun, a gut instinct for what was good for and what was bad for the body. And things that we've maybe dismissed as myths for a long time have actually been shown to be very accurate. So Hippocrates was absolutely right, and I'll try and show you a little bit tonight about why he was right. Just want to distinguish before I go on about the human microbiome and the gut microbiome. They're part of the same thing, but we don't just have all these microbes that I'm going to be talking about in the gut. The whole of the human body, our skin, all our orifices, so the nose, the mouth, the eyes, our genitourinary tract, all of these, our ears even, are all colonized by lots and lots of organisms. So beyond the gut, we have got lots of other microorganisms living in us, but we're concentrating tonight on the gut. So there are various estimates about the number of organisms that live on us and within the human body, and that's what we call the human microbiota. It's commonly said that human cells are outnumbered 10 to 1 by other organisms. Oh, sorry, I've just spotted yet another typo. That's supposed to say organisms in that middle bullet point. People can't count them absolutely accurately, but they do reckon that for every one human cell in the body, we've got at least 10 other organisms living with us. So we are talking about trillions and trillions of organisms. And they comprise bacteria, fungi, and viruses in the main. There are one or two other little species that are less significant, but huge numbers of organisms that are incredibly important to our well-being, but have been very underestimated for a long, long time. So we're going to focus on the gut microbiome. And it is important to realise that bacteria and viruses are not always bad. We tend to think of them as being harmful, but in fact we rely on them to help us with healthy function of the body. So the ones that we regard, and you'll probably all be familiar with the television advert for a particular brand of yogurt that talks about the friendly bacteria. These are known more officially as commensals, so they're complementary, if you like, to our well-being, as opposed to pathological or bad for our well-being. So we are colonized by, as I said, trillions of these organisms, and it is really important that they're there in the right balance in order to help our body to function properly. And we're just catching up now with Hippocrates and realizing how vital for our general good, both physical and mental health, because actually they feel now that the gut is our second brain, and what they call the gut-brain axis determines much about our sense of well-being. And again, it's not really a surprise when you think about it. If you're worried or frightened or stressed, you know that it can cause the old saying of butterflies in your tummy, which is a polite way of saying you get gripey, spasmodic pain that might actually require you to run to the toilet because you really feel you need to, have bowel action, which can be anything from normal to very unpleasant. And that's all part of the brain influencing what's going on in our gut, and vice versa. So they're very much communicating all the time, and the well-being of one is dependent on the other. And the more I'm learning about the whole way, I mean, I trained as a nurse 47 years ago, and I thought I knew a bit of physiology, but oh my goodness, it's so complicated, and I'm learning more and more about how one thing determines what happens in another part of the body. One hormone helps to regulate another hormone that regulates another function, and this whole cycle is so vitally important to be in balance. And an awful lot of what we do in modern life, as well as our modern diet, is really upsetting this nice fine balance. And the gut microbiome is very definitely being affected by modern life. So what the microbiome actually does is obviously helps with digestion. You know, we just think food goes through our gut and gets broken down and the nutrients absorbed, but actually it's not a simple matter of that happening. Well, we've been aware that we get enzymes that come from our pancreas, we get bile, which I'm learning slowly about is an incredibly vital fluid that is part of our well-being, not just digestion. And these things are stimulated by food passing through the gastrointestinal tract, and they help with digestion, but it's much more complex than that. And all these wonderful organisms that live in our gut, the good bacteria and viruses and fungi, they actually help with this whole breaking down of the food in order to allow our absorption of nutrients. If we don't have the right microbiome, this is where we get what we used to call in the medical world intestinal hurry, which just means that food goes through the gut improperly digested, and therefore most of the nutrients aren't absorbed. So we now understand much better that all these organisms are required for that to happen properly. We also now realise that 75% of our immune system sits within the gut. Specialised cells that line the gut or lie just behind the lining epithelium and tissues of the gut that are very integral in helping our body to sort out what's a threat and what's beneficial. The microbiome helps to regulate our metabolism, and we're now learning more about how if the microbiome is out of balance, this can be one of the things that can lead to diabetes and many other chronic diseases. The vitamins that may come in part form, if you like, in your foods, the microbiome helps to complete the process of making these into beneficial vitamins, micronutrients for the body. the microbiome protects and feeds the lining of our gut to keep it healthy, to allow it to do its very important job. So there's been some recent papers, and I put a link on here, of the importance of the immune action of the gut and the microbiome, and therefore it's yet another thing that could be a predictor of people who do less well with COVID infection. But also more and more psychologists and psychiatrists are taking an interest in the gut now, because they starting to realize that serotonin, which is what we call the happy hormone, it's the well-being, sense of well-being hormone, that is very much affected by the microbiome as well. So an awful lot of really good positive things happen in the gut if it's well balanced. But when the microbiome's out of balance, this can lead to depression, to autoimmune conditions. So there's a myriad of those now that are common in modern life. Inflammatory bowel disease, which is sometimes seen as an autoimmune condition, but actually can be directly caused by poor diet and the microbiome being out of balance, and the predominance of bad organisms proliferating that cause damage to the bowel. And as I've mentioned, diabetes is now associated with a poor microbiome. And in fact, when your microbiome isn't working properly, this can lead to weight gain because the wrong constituents of food are being absorbed. And again, the balance of nutrients is wrong. And this can cause hunger and overeating and weight gain. So we're only just beginning to see the tip of the iceberg with all the different things that poor microbiome can be responsible for. So the reason for us believing that we seem to be suffering more from poor microbiome in modern times than we were maybe even 50 years ago is probably due to an awful lot of the things we've been talking about over the recent months to do with modern life. The cumulative stress, the fact that we are probably taking more and more medications now that affect our gut, that we are exposed to more and more toxins, both just in our daily life, as well as within the food that we eat, and just the general stress of life. We're all trying to do too much. We've talked about this before. So all of these things impact our gut. And a syndrome that is becoming well recognized now is called leaky gut. And the two little pictures here, the one on the left is what a healthy gut, and we're looking here at the large intestine. And we should have the cells all nicely packed together. It's what we call really tight, healthy junctions between each cell. We have a nice, healthy mucous membrane that allows the food to pass along, and all these lovely villi, they call these little finger-like projections that stick out of the cells, there to increase the surface area to help us to absorb more of the goodness. And all of this should work in tandem with each other, and the food particles pass along, and the good bacteria thrive, and they help to digest the food, and they help to direct the appropriate micronutrients, etc., to be absorbed into the blood, and off they go to do whatever they need to do around the body. Now, when this goes wrong, because our microbiome is out of balance, we get what we call leaky gut, which is where the cells are less healthy. We get these gaps between the cells, these faulty junctions, and that's what the leakiness means. The villi can get flattened, so they're less able to absorb. We get a preponderance of the bad bacteria and toxins, so not only do they stop the good bacteria doing their job, but they can start to be absorbed themselves. We can also get particles from the food, larger protein molecules and things that shouldn't be getting into the bloodstream passing in, and these can cause the autoimmune reactions that we know are associated with many of the modern chronic diseases. So everything is going very badly wrong here, and it can lead to all sorts of different conditions, diabetes being just one of them, but rheumatoid arthritis, thyroid problems, lots and lots of different modern chronic diseases. Puts a huge stress on the rest of the body, and this is all because the microbiome in the gut has been disturbed and is not being able to do its job, and the actual fabric of the gut is now starting to suffer, and it's not doing its job properly. Diabetes, as I say, has been associated with poor gut health. So a higher blood sugar after meals reduces the beneficial bacteria. The bad bacteria thrive on sugar. So if you're eating a lot of foods that break down to sugar and your body's not able to handle this very well, this really will cause damage to the microbiome. So we know there's an association now with type 2 diabetes. The leaky gut that I've just been talking about, allowing various molecules, proteins and so forth through, can lead to damage to all sorts of organs, which include the pancreas, where the insulin is secreted. So this in itself can help to contribute to diabetes. We also know that people who have non-alcoholic fatty liver disease, which is a disease we now know occurs because people are having far too much carbohydrate in the diet, which has been broken down into sugar and being turned into fat in the liver. There is a significant connection now between those people having a very poor gut microbiome and the diversity in their gut is much lower, and therefore again is associated with high blood fats and central obesity. So everything's sort of starting to come together in our understanding that all of these things are linked. An unbalanced microbiome can also increase the likelihood of you becoming insulin resistant, probably for all the reasons I've just mentioned. Things that damage our gut and gut microbiome in modern life are antibiotics. We know there was a terrible tendency, which the medical profession is trying to address nowadays because of antibiotic resistance, apart from these issues. People were being put on antibiotics, you know, on a whim, far too frequently. And antibiotics, the whole purpose of them is to destroy bacteria. And the problem is they don't distinguish between good bacteria and bad bacteria. So, you know, if you've been on repeated courses of antibiotics, it's highly likely that an awful lot of your bacteria have been destroyed. It's really hard to rebuild it unless you're eating a really healthy diet for the gut. Also, other medications that have become very commonplace now that people use an awful lot, such as the non-steroidal anti-inflammatories, which is what that NSAID stands for. Things like ibuprofen, which can be bought over the counter and a lot of people, you know, take very regularly. Protein pump inhibitors, often abbreviated to PPIs, they are prescribed almost like Smarties now. It frustrates me terribly that they are given out so frequently when actually a change of diet will often remedy an awful lot of the symptoms that people are given these for. And whilst they're not going to destroy the bacteria in themselves, they reduce the acid in the stomach. And the acid in the stomach is incredibly important for stopping the bad bacteria and also for the early digestion of food. So food is getting through perhaps with some of the bacteria that are not so beneficial, also partially digested. This is not going to help the biome further down the actual gastrointestinal tract. We are meant to have acid in our stomach for a very important reason that I'll come back to. So suppressing it is not a brilliant idea, certainly not permanently. These drugs, when they were first devised, were really meant to be used as a sort of a short, sharp treatment for somebody with severe reflux who'd caused a bit of damage, and to really help to allow that to settle down. They were never really meant to be taken for years and years and years, and yet unfortunately that's what seems to happen a lot these days. What else damages our gut? The refined carbohydrates, sugar and ultra-processed foods and seed oils that we've been talking about over the whole series of these talks. These things are really, really bad for our gut, full of nasties. The sugar, as I mentioned, encourages the bad bacteria. The ultra-processed foods, particularly the seed oils, cause inflammation that damages the gut. And none of these things are helping the microbiome at all, and many of them are damaging it. Gluten, and I'll talk a little bit more about that in a minute. people say, oh, but generations ago they ate bread, they had porridge. Why are we suddenly saying it's bad? It's because those products have actually changed. They've been artificially tinkered with to improve yields and so forth, and therefore the products we get today are much harder for our gut to digest than those that went before, and certainly don't give any benefit to our microbiome. So they're actually doing harm now rather than good. Artificial sweeteners, they can encourage insulin resistance, and again, the chemicals, if you're using the bad ones, we have mentioned a few of the better ones in the past, but things like saccharin and aspartame, these are not kind or helpful at all to the gut. Chronic stress, which we've talked about, it has an effect on just about every part of the body, and that again will affect our microbiome. Chronic infections, because the immune system has been weakened, disruption of the body clock. Our microbiome is very affected by our circadian rhythm. So people who work shifts or people who travel a lot and cross time zones frequently, they will often find they have a lot of gut problems, and that's because their microbiome has been badly affected. Plastic in many of the containers and utensils that we use these days, they can also have a bad effect on our biome. Babies born by caesarean section miss out, and in fact modern life in general, and unfortunately in the last 2 years, because of for good reasons, but I do worry it's being taken to extremes now, hygiene has become very critical, but actually we do need to be exposed to some organisms regularly. It really helps not only our gut but our immune system in general, so being very sterile about everything you do in life is not good for you, and babies born by caesarean sections miss out on the vital organisms that they pick up by traveling, if they're a normal delivery, traveling through the birth canal. The baby who's been in a completely sterile environment in utero is actually exposed to its first organisms, and they are very important for setting up that child's microbiome. Can be combated a little bit if the child is breastfed, because breast milk is very much designed to help to encourage the microbiome to develop. About 80% of what's in breast milk is not actually that digestible, but it's there to help increase the child's microbiome. And it's obviously designed specifically for human babies, so the baby's getting absolutely the ideal food for itself, and it's got the best chance of starting life with a really good set of gut bacteria. A child that's brought up in a house with pets, child that is allowed to crawl around and play, and without a mum that's too obsessed with hygiene, obviously you've got to be sensible, but children need to be exposed to organisms, and therefore to a child born by caesarean who's not breastfed and who's kept in a very sterile environment is going to probably reap very bad rewards for that in the future. And I'm certainly aware of several cases of people with extreme eczema and asthma who have had that kind of infancy, and it takes them nearly all of their life and only with really well-informed medical support can they kind of replace what they didn't get as young infants. So a little speck of dirt, as they say, doesn't do any harm, and we do need to be wary, especially at the moment when we've kind of become a bit obsessed about hand gels and hand washing and not exposing ourselves to other people too much. I don't mean exposing ourselves in a bad way, that sounded awful. You know what I mean, not mixing with other people, all of that. We've got to be wary that we don't go too far, otherwise it's not going to do us any favours. So all of these things that are quite common in modern life are not helping our microbiome at all. I mentioned the wheat, and really, unfortunately, in the last 40 years or so, the genetic modification in order to improve crop yields, etc., has meant that we've now got wheat that probably bears very, very little resemblance to the kind of wheat that our parents, certainly grandparents, would have used. And that's why it's doing us so much harm. And also at the same time, we have increased our consumption. You know, our parents wouldn't necessarily have had, they certainly wouldn't have had Mr. Kellogg's products. They may have had very basic oats and things that were grown in a very more wholesome way. But they wouldn't have been having the cereal, the bread, the pasta, the biscuits, the pizzas, the constant hits of this modern wheat that an awful lot of people are having in life today. And this is not doing the microbiome any good at all. So this is why we worry that gluten is causing such a problem. It's not just people who've been diagnosed with celiac disease. There's a lot of people who are very sensitive to modern gluten. And a lot of people see huge improvement when they cut out these products. We certainly know that it disrupts the microbiome and is one of the main causes of leaky gut, and therefore goes on to lead to many inflammatory conditions, from joint pain to acne to eczema, asthma, all sorts of things. And there are lots and lots of examples of people who have had dramatic improvement in these conditions once they've cut out gluten. So foods that will help your gut are real foods, as we're always talking about here. So things that are probiotics, these will be things that actually contain the organisms that are going to be helpful to your gut. Fermented foods are really, really good. So the kefirs, sauerkrauts, kimchis, kombucha. There's lots and lots of different probiotic foods now becoming more and more available. Yogurt. Prebiotics are foods that will help to feed the microbiome, and they need to be fed. And this is why we talk so much about fibre being important. I think for a long time we thought fibre was only necessary just because it formed bulk that allowed your gut to push things along. But actually we now realise that fibre is important, because that's where the bacteria and etc. live and reproduce and can really thrive, and therefore help with all the jobs they have to do. Things like bone broth, if you're not vegetarian, that's what's in the saucepan in the picture. Again, this is really, really helpful for the gut. Coconut oil has been proven to improve the gut. The omega-3 fats found in oily fish and grass-fed meat are very good. Now, if you're a vegetarian, again, you really need to be working hard at finding a source for these and making sure that you're not short of them. Extra virgin olive oil, that contains more omegas, omega-9, which is also good for the gut. And there are a number of herbs and spices that are particularly useful for improving the gut. A lot of the bitter ones, oregano oil, you can buy that in a capsule format that you can swallow, but an awful lot of the recipes that people have used for generations contain a lot of these herbs and spices. So turmeric, very anti-inflammatory, very helpful. You know, a lot of you are probably eating quite a lot of the right things. It might just be that there's a few issues you need to be addressing, particularly cutting out some of the more modern harmful foods. Bitter herbs, as I say, things like rocket, arugula, I think the Americans call it, that's supposed to be very beneficial, particularly for stimulating bile, as is grapefruit. We don't encourage lots of fruit in our low carb approach to life, but bitter fruits like lemon and grapefruit can be quite good at stimulating bile. And bile is really important, not just for emulsifying fats and helping with the digestion of fats, but also transit of the food along the gut is lubricated by bile. But we also now know it stimulates other hormones. And when we were all encouraged to go very low fat, that's sort of slowed down the stimulation of bile, and that's not a good thing. So again, we're learning low calorie diets can also really affect the gut microbiome. So a lot of things that were being touted as healthy 20, 30 years ago, we now realize actually were very detrimental to our gut health. Intermittent fasting, however, which I've tried to explain before, is different to going on very low calorie starvation type diets. Intermittent fasting, where you're eating really healthy food either side of a period of fasting, is very good for your gut, because this allows the gut to have some time to heal, to properly digest what went before, without being bombarded constantly, particularly constantly with poor foods that are not helping it. So intermittent fasting is really good for building up a healthy microbiome. So prebiotics, these are the ones that I say feed the bacteria. So foods like onions, garlic, leeks, chicory, dandelion greens, artichokes, Jerusalem artichokes, asparagus, cacao, nuts and seeds, and resistant starch. So resistant starch is a bit harder. It's probably something we need to talk about separately. Inulin is a product that you can actually buy to add to foods. That's a resistant starch, so it means it's not easily broken down, and therefore it feeds the microbiome rather than causing sugar spikes, etc. New potatoes that have been cooked just to sort of al dente are kind of resistant starch, and pasta that is cooked al dente, so it's really still got a lot of bite to it, will provide a bit of resistant starch. Apparently it's even better if you let it go cold. I'm not quite sure I really like the idea of cold pasta, but these are things that rather than being broken down and absorbed and therefore causing harm, can actually provide the gut with prebiotics. But many of the other vegetables, I think, are things we'd rather you concentrate on. Using things like pre and probiotics together. So I mentioned probiotics are things like kimchi and sauerkraut and so forth, which you can add to a salad. So you've got some of your prebiotic foods in a salad, but chuck a bit of sauerkraut onto it, and you've improved the balance and the benefit to your gut. Using garlic in with some of the foods that are really good for your gut will help. Yogurt, which has got both pre and probiotics in it, if you use the garlic and make it into a dip. Sauerkraut, which is a probiotic with raw onions and so forth. These are all combinations that really help sort of each food to improve the effect it's going to have on your gut. So thinking about putting meals together that are really going to not just taste good, but benefit the gut is a good idea. And there is some evidence, and again, I've given you a link to a study that's just been published that shows that if you really look at improving the foods that you're eating, particularly your pro and prebiotic foods, if you have had a bad time, perhaps you have been very poorly, you've been given courses of antibiotics, or you've been under a lot of stress, and you really feel you've perhaps not been eating as well as you should, and that your microbiome has probably suffered, then they reckon that just 2 weeks of increasing dietary fibre with the right kind of foods can really improve your microbiome. So it's not the end of the world if you've had a bad time, but you can, if you work at it, you can really improve things quite quickly. And just as in diabetes, we've shown that if people really address the carbohydrate in their diet and reduce that dramatically, they can bring their blood sugars down very quickly and lose weight very quickly. So by using the same process, really, because these foods are exactly what we want you to be eating if you're going low carb, they will improve your gut microbiome. So it's win-win. And that's it. I don't quite know what's happened. I'm sure there were a couple of slides there that showed the gut, didn't seem to appear. I don't know what happens when I go onto this screen share, but I was just going to mention with a diagram of the gut where the bacteria are. The vast majority of them are in your large gut, so the last bit of the bowel. So obviously the gastrointestinal tract starts with the mouth, and there are some beneficial bacteria in your mouth that not only protect your gums, but also start the very rudimentary. You've got enzymes and so forth in the saliva, but you've got some good bacteria there as well that help with the very basic breaking down of the food. And chewing your food thoroughly is one of the best things you can do to help your microbiome. So chewing well and not using mouthwashes, because mouthwashes will destroy your good bacteria as well as any that you're concerned about. So good oral hygiene does mean, you know, looking after your teeth and cleaning them well, but general purpose mouthwashes are actually just, you know, sledgehammer to crack a nut, and they actually do more harm than good. So try not to use those. But your digestion starts in your mouth. As I mentioned, your stomach is acidic, so we don't have any bacteria, or shouldn't have any bacteria in your stomach. If you're on PPIs, then you are slightly more prone to getting bacterial infections through the gut, because you haven't got that protective acid there. Taking something like lemon juice in water or apple cider vinegar can help. But obviously, if you're on PPIs, the easiest thing is to have a chat with your doctor and find out, do you really need to be on them? Could you have a trial possibly of seeing how you go? I would always taper them off. If you've been on them for a long time, I wouldn't just suddenly stop. But it might be worth just seeing whether, if you've now got your diet sort of in better shape, could you actually cope without those PPIs, and see how that goes? Because very important digestive processes take place in the stomach in the presence of acid, and that's really the early breaking down of the food to allow the rest of the gut to digest it more easily. Then the small bowel really shouldn't have any bacteria, but again, because of the lack of stomach acid and various other things that go on with modern diets, sometimes you get a colonization of organisms in the small bowel, known as small bowel, SIBO. Daxa, help me.
Small intestinal
bacterial overgrowth. That's it. I knew it would come to me. Small intestine bacterial overgrowth, which can cause a lot of bloating, a lot of discomfort, and sometimes needs specialist help to overcome. Now, one of the things that can help with that before you have to resort to antibiotics is taking a capsule that has things like oregano oil and thyme oil and so forth in it, if it's not too bad, or incorporating plenty of those herbs into food that you're eating. But all of the concentration of the microbiome that I'm talking about is really in your large bowel. That's where it should all be going on. So a lot of the breaking down of the food goes on in the stomach and the small bowel, and then the large bowel has the final job to do, and it reabsorbs a lot of fluid and a lot of the nutrients. So that's where the microbiome should be thriving, and that's where a lot of these foods that we're talking about being good for the microbiome will do their job. So I know that slide should have been there, and I don't know where it disappeared to, but it just really showed you the track and where the microbiome is at its most important. So with that, I'll stop screen sharing. That really is a whistle-stop tour of microbiome, and it may be that there's certain elements of it we can come back to another time, but it's just such a massive and newly growing topic that even I am really just at the tip of the iceberg about learning about it, and I've come across quite a few really good websites talking about it, so we can share some links on the WhatsApp group, etc.
Thank you for that. That was really informative. I hope everybody enjoyed it. So we've got a few questions. Nishila has said, what does inflammation in the body mean? And has the gut bacteria got anything to do with it?
So inflammation, inflammation simply means swelling, I suppose. And inflammation of any body part is not good. So if we talk about something being inflamed, it's usually where the tissues have been threatened either by an organism like in an infection, or in the case here where we're talking about proteins crossing the gut wall that shouldn't be getting into the bloodstream, causing like an allergic reaction. So you're getting inflammation because the body's trying to protect itself against this substance that shouldn't be there. And when the body tries to protect itself, the cells expand to allow the fluid. You've always got fluid between each body cell. You've got what we call interstitial fluid, which just means between the tissues, and the swelling occurs and extra fluid arrives at the site of inflammation to allow the cells that are involved in the immune system to pass through more easily and do their work and proliferate. So inflammation is nearly always caused by pain because you're getting a stretching of whatever part of the body it is. You're getting extra stresses on it. And I hope that helps a bit. So inflammation is not good. So it could be inflammation just in your skin where you've had a cut and you've got a little bit of an infection going on, or it could be inflammation in the tissues that line your joints and cause the joint pain. Obviously, when you get a common cold, you get inflammation of the nasal passages and your throat, and that causes the discomfort that you associate with that condition. And you get a lot of streaming of mucus because those tissues are inflamed and producing lots of fluid. I hope, does that help? What was the second part of that question?
Has the gut bacteria got anything to do with it?
Well, yes, if the gut bacteria is in the wrong balance, then the gut lining, as I've described in that leaky gut section, allows protein molecules particularly that shouldn't be coming through to come through and challenge the body and cause the inflammation. So absolutely, we are now starting to realize that the gut microbiome is often the real problem area, rather than modern medicine has a tendency to just say you've got a swollen joint, so let's treat that swollen joint. It doesn't think about treating the microbiome and going to what we call the root cause of the problem. So obviously you can get inflammation in a joint because you've damaged that joint through a trauma. So that wouldn't be the leaky gut's fault in that particular instance. The trouble is some of the things they might give you to help that damaged joint might damage your microbiome. But whoever asked that question, could you say, has that helped a bit?
Sheila, would you like to say something? Unmute, maybe. She's
Hi.
unmuted. Thank you.
Hi, can you hear me?
Mm-hmm.
Yes.
So it has kind of helped, but I just had a couple of follow-up questions. So when I eat carbs, I've noticed that I get my feet swell up. Is that inflammation? Am I allergic to carbs? What is it?
It's not so much that it's you're allergic to the carbs, but carbs do. We know that sugar, it's sugar rather than salt. We used to blame salt when people got puffy feet, or we thought people were holding fluid in their bodies. But actually we now know that when you've got more sugar, it's the sugar that actually attracts the fluid. And therefore, if you do notice that sort of thing, then it does show that you're probably intolerant of carbs. Could be that you've got metabolic syndrome. Do you know if you're diabetic or not?
Borderline, but because I'm doing low carb, it seems to, so I think I'm controlling it through diet, but I think if I was eating normal, I would probably be.
Yeah, so it sounds like you probably are quite sensitive. So if you're taking on board a lot of carbs, that will encourage fluid. An awful lot of people, when they first go low carb, find they lose a lot of weight quickly. And a lot of that weight is the fluid that they've been holding because they've had more sugar in their diet than they should. I wouldn't say that it's necessarily inflammation that's causing that in you. It's more just the dietary content.
And if I continue to do a low carb diet, would the sensitivity get better, or will I always have this problem?
Well, we tend to say that, we can reverse diabetes, but the tendency will always be there in people who've had it. So we would encourage you to try and stick mostly to a low carb diet. If you really get the blood sugars under control and back down to normal levels, a high day and holiday, blast with some carbs is not going to suddenly turn you diabetic again overnight. But we would caution against going back to eating the way that possibly you did before you realized you were on your way to diabetes. So I think you've always got to be careful particularly with the refined carbs, the sort of processed foods. Carbs in your vegetables and that you acquire through eating real food, hopefully will not cause you a problem once you've got yourself properly, into the non-diabetic state.
Okay, all right. Okay, thank you very much, Caroline.
Okay.
Can I just ask something, Nishala? You obviously asked a gluten question, so I'm just wondering, these carbs that you're occasionally consuming, are they gluten-containing carbs?
No. So I think I kind of lost my way in between. So I had a really bad 2 months where I was eating everything in sight, and I think I suddenly noticed all the like swelling and everything came back. So that's what made me sort of realize that actually there's a connection between the carbs and the swelling in my feet. So as soon as I stop eating carbs, my swelling goes away. But my question on gluten was, because I know, Caroline, you mentioned something about gluten being bad for you, and on keto and low carb, I usually have vital gluten. What's it called?
Vital wheat gluten.
Yeah, absolutely. And the reason I have that is because I was told that it's got very low carbs, and so now am I right in assuming that that's no good then, because that's just pure gluten, right?
It's a tricky one, that, because I know a lot of keto breads and things do use it, and I think it's something that I would caution against having a lot, and you've got to use your own individual judgment on how it affects you. I can't eat it. As soon as I eat it, I get really bad stomach ache. Right. So it's really helped me to realize that I am very sensitive to gluten. But if you tolerate it, and you do want to have you been using it in a bread mix or something?
Yeah, I use it in either when I make chapatis or bread, and I want to sort of experiment making seitan as well, because that's got a lot of of it. But I haven't made that yet. But but I don't have it a lot. I'm just obviously I thought it was okay, and because you mentioned gluten being really bad, I thought, oh, okay, was I not supposed to have that?
I don't honestly know how do you know, Dacia, how they make it?
I don't know how they make it, but I recently read about a study that for people who really don't tolerate gluten or have gluten sensitivities, the effects of having something with gluten in can last for 6 months in their body.
Oh, really?
I can share that study with you.
Okay. I'm not gluten intolerant at all, so I think that's not an issue. I don't think I suffer from that.
So I mean, it is an individual thing, and I would just caution against using it too much. But because there are things like psyllium husk that you can use in sort of low carb bread mixes as well that help offset the lack of gluten. So I would keep it, to a minimum. Yeah, no, I use psyllium husk as well, but I think the gluten gives a little bit of a chapati stroke bready flavor, if you know what I mean, because it's more closer to wheat than psyllium husk. But I know what you mean. I know what you mean.
Have you ever eliminated gluten and then reintroduced it?
Me?
Yeah.
No, but I don't have a problem with gluten, so I've never needed to. Well, obviously, the only reason I'm asking is because of the slide where Caroline mentioned that gluten is bad for your gut, and I was thinking, okay, I don't have an issue and I have it, but am I supposed to stop it because I don't want it to be causing problems internally that I'm not aware of?
Well, this is why, because you've obviously mentioned the carb and the swelling, and is it really the carb or is it the fact that you're having carbs that have got gluten in it? So it's sometimes worth going a little bit further with your experimentation. I would have thought once upon a time that I didn't have an issue with gluten, and I had to give up gluten because now I have an autoimmune condition, which I think was probably due to the gluten that I didn't realize was destroying my gut lining.
Okay, and I'll try that. I'll try not
leaky
having
gut.
Yeah,
so
I agree with.
Go on.
Yeah, I agree that I think it's worth trying a period without it. and seeing how you feel. But sometimes you don't kind of feel you notice much difference without it. But then when you reintroduce it, you quickly spot that a certain symptom comes back.
Yeah.
So I do think, because it is a food that we know, or a substance that we know can cause a lot of problems in the gut, it's worth trying to do without it.
Okay, I'll try that. I'll try that. Thanks for that, Caroline.
And then there's a question from Nishila again.
Oh, sorry.
It's okay. Don't apologize. She's put, I thought artificial sweeteners don't spike insulin. So how does that contribute to insulin resistance?
It's obviously, it's a complex business, the sweetness and the body's response to it. And there is some evidence to show that even artificial sweeteners send the kind of signals to the body that you've had sugar, and cause the same sort of reactions, which is a reason why we tend to try and encourage people not to just find alternative sweet goods when they're going low carb. You can get quite a lot of recipes, and some websites just seem to be endlessly churning out keto cakes and low carb sweet goods. And really, we feel that you get better benefit if you train your palate to want less sweet stuff, because, as I say, there's very complex links between the brain and other systems. And there's good evidence to show that constantly using sweeteners produces a similar effect to having a lot of sugar, and therefore doesn't help with insulin resistance. Again, I know that's a bit waffly, but
yeah, Karen, I sort of agree with you, because I've tried to do a lot of research, and I get such conflicting information online. It's slightly confusing as to, because some people say that, well, actually, you're right, it does, your insulin is produced, but not as much, because it thinks it's getting sugar. But then obviously, because you're not having sugar, nothing happens, the insulin just disappears. So it really doesn't affect you. And then some people obviously say that, yes, it does. So it's a little bit confusing whether, and I have a lot of coffee and I have sweeteners in it, sucralose, which I'm trying to wean off. It's very difficult though.
Yeah, it is, but I really would encourage you to persist with trying to get rid of it altogether, because too many sweeteners, even the more natural ones, are not good. And it's really training the brain to not need that sweet hit.
Yeah, I know, it's so hard.
It's so hard. You'll get the ultimate benefit if you can do that.
Yeah, no, I agree. I know I've been trying for several months now. It's just so hard, but I have to try harder.
Is it? Yeah, no, nothing worth having is easy. But, it is. I mean, you have to go through the pain with giving up sugar in things, but eventually you will get to a point, I promise, where if somebody puts sugar in it or a sweetener in it, you'll think, oh, this is disgusting. And you know, but it does take persistence, I'm afraid.
Yeah, thanks a lot, Caroline.
Okay. Somebody's asking about, does the microbiome die when you die? That's a fascinating question.
That is fascinating.
Yeah. Well, I'm sure the microbiome will die off, because its supply of nutrition will go. But it probably, this is very macabre, but it probably is part of what starts the whole decomposition process. Because the organisms probably start to eat the body. So I think I'll leave it at that, really.
Next question: apple cider vinegar in liquid and taking capsules, is the effect the same?
I think so. I think the capsules are there really for people that can't tolerate the vinegar, because you know, there's a lot of evidence to show that apple cider vinegar taken before a meal does help with the blood sugar levels, but some people can't tolerate it, so it's too acidic for them. And I think there is some evidence to show that taken in capsule form, probably don't get exactly the same benefit, but it is worth doing if you really can't tolerate it. But if you are going for apple cider vinegar, then it should be the properly fermented with mother, as it's called. So you see the cloudy bits in the bottle that show it is fermenting. And you'll get the maximum benefit from that. But yeah, if you can't tolerate it, then the capsules would be better than nothing.
But is cider vinegar good for diabetes?
Yes, Yes, there's some evidence to show that combination of metformin and apple cider vinegar taken before meals produces better glucose control than just metformin on its own.
Okay.
So,
But cider vinegar it's very sour. Is it? It's very sour.
it is.
And every time, even a drop of lemon, I can't even take that. I land up with cramps, having cramps middle of the night.
So, you know, you're one of the people where the capsules would probably be better if you want to go down that road. But I mean, it's one of many things you can do to help with the gut and the microbiome. So it might not be your thing, because there are some people who really don't tolerate it well. So you might be better. I mean, can you not take a little bit of lemon juice in warm water?
No.
So maybe having plenty of bitter herbs in your foods would help you in a way that, you know, that can help other people.
But funny enough, you mentioned garlic and that. We've been eating garlic from birth.
Yes.
So
a lot of traditional foods are really, really good for us, and it's all went wrong. All these refined, processed, ready meals and things pumped with chemicals, and, you know, food that really doesn't resemble where it started. That's where it all went wrong. A lot of the stuff that, you know, our parents and grandparents, or that we were brought up on, was perfectly fine. And, you know, I was a skinny teenager because there were no McDonald's, there were no snack bars, you know, I didn't have pocket money that meant I could have snacks between meals. You know, I literally just had 3 good meals a day and lots of exercise. And, you know, that was I finished school in the early 70s. So being brought up in the 1960s, you know, if you look at pictures of people on the beach in the 1960s and indeed the 1970s, you won't see very many fat people.
No.
Because we didn't have all the stuff that's making us sick now and making us fat now. So we've just got to try and strip back to eating the way either we did in our childhood, if you're as old as me, or the way our parents and grandparents ate.
So I've got a question that's come directly to me, so I won't disclose who it is, but somebody's saying that they've got ulcerative colitis and they cannot eat gluten and so much other foods. And I just wanted to add that's an autoimmune condition. So for that individual, if they are interested, then I would suggest they do a reset, which is eliminating a lot of foods and then reintroducing them to see what they can tolerate, and that way you personalize your diet. If you need more information around that, you know, we can provide that, can't we?
We can, and absolutely. You know, I know it is one of the many sort of more modern. I mean, it has been around. I remember nursing people with ulcerative colitis in the 1970s, and therefore we can't blame the absolute rubbish that's around now on that. But stress and various other things can aggravate that kind of condition. As I was saying, that the brain and the gut are very closely linked. The vagus nerve, which is the main nerve that kind of serves the gut, the link is so close that stress and chronic stress can drive that kind of autoimmune condition. So as well as looking at what foods you're eating, it's really important to address, you know, sleep and meditation and anything that can help with the stress levels.
Absolutely.
It becomes a self-fulfilling thing as well, because the condition itself can cause stress. So it's trying to sort of get life organized to minimize the stress as much as you can.
Yeah.
Does sleep have an effect on the gut health? I'm seeing there, absolutely. As with so many things, I mentioned the circadian rhythm, and we've talked about sleep before, and having adequate sleep, which really should be 7 to 8 hours a night of good quality sleep. That is when the gut really gets an opportunity to repair, to rest. That's one of the reasons why it's probably not just an old wives' tale not to eat just before you go to sleep, because you know the gut isn't going to benefit from the rest then, because it's got all that food to digest. Yes, sleep can definitely be beneficial, good sleep to gut health.
If you're taking sweeteners, which would you recommend?
Sweeteners, stevia or erythritol, xylitol, they're the ones that are probably the best. I would stay well away from saccharin and aspartame and those really chemically artificial ones. But stevia and erythritol are derived from natural sugar alcohols. But none of them should be taken in large quantities and taken regularly if at all possible. See one there on the hiatus hernia. An awful lot of people with hiatus hernia are find great benefit in changing their diet and going low carb. I think we've been led to believe that PPIs are the only thing we can do. I've got hiatus hernia, but I don't take PPIs. You know, I think it's a matter of trial and error again with finding which foods and actually, again, avoiding the foods that people have traditionally been told not to have if they've got any of these stomach problems, like fatty food and you know, good wholesome protein based foods, etc., is actually completely the wrong way to go. As I mentioned, stimulating bile and all of the hormones we're supposed to have in our gut when we're digesting food is dependent on having that good balance between proteins and healthy fats and not too much carbohydrate. So I wouldn't agree that PPI is essential if you've got hiatus hernia. So it is a matter of trying to experiment with which foods cause you more problems. Again, if you've got anything to add to that, that's a...
No, I would totally agree. I think PPIs have so many other reactions that you don't really want, you know, suppressing your acid.
They were never ever intended to be prescribed. I mean, I tear my hair out because both my parents were on them and have been since they were launched, which is probably 20 years ago now. It drives me absolutely crackers, but they will not hear of stopping them. But they were never meant to be taken for that long. They were meant as you know, a help to ease symptoms, to allow the stomach to recover, not to be taken permanently. And you know, you need acid in your stomach. And as we get older, we naturally produce less acid, which is why a lot of older people suffer from indigestion and have to learn how to manage it. And things like apple cider vinegar can help. So it's a matter of, again, you know, patience and trial and error. And, you know, as you know, I don't want to give people medical advice and tell them to stop taking medication, but I would think seriously about having a discussion with doctors and looking at a period of tapering them off and seeing how you get on and experimenting with different types of foods.
Yeah, my mum, she is on PPIs, and her whole, everything you've just described about SIBO, you know, the small intestinal bacterial overgrowth. My mum's a classic case, but she trusts the doctor.
Yeah.
And his word is the last word, and it breaks my heart because I see her suffering, and we've done much to try and change her, try and get her off the PPIs, but it's proving to be very, 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 very difficult. And so we're back to square one now. So it's I wish that, you know, the GPs would recognize that it's really detrimental for people. But anyway,
apple cider vinegar causing constipation. I can't see why it would.
No, I can't see why it would. There's no reason for it to. So somebody has asked, is maple syrup okay to have?
No. Maple syrup is sugar.
Sugar, yeah. Does microbiome imbalance cause psoriasis?
Yeah.
That's
I
it.
mean, it's psoriasis. Well, and I say, yeah. Psoriasis is another one of the autoimmune conditions. And an awful lot of these skin conditions, that really severe eczema and psoriasis, they often find you can go to, unfortunately, it's not as commonly available in the NHS, but you can go to functional medicine practitioners who will do a test of your gut microbiome. And they often find people with these really bad skin conditions have got hardly any of their healthy bacteria. As I mentioned, people who've had a very sterile environment growing up, who suffer very badly, they actually, I mean, it sounds gross, but they do fecal transplants now, where they actually take fecal matter from healthy people and transplant it into the bowel of people with these severe problems, and it does help. You know, a disturbed microbiome can cause most of these autoimmune diseases. It's all part of the, you know, we talk about being food, and obviously the important bit of food is it's got to be digested appropriately and absorbed appropriately, and that's where the microbiome comes in. So putting the right stuff in your mouth in the first place is really important, but making sure it gets handled correctly on the way through is the second part of that equation.
How do we get the microbiomes tested? Is it via GP?
I think it would tend to have to be through a functional medicine person. You can, it's like everything, you can go online now and find companies that will send you home test kits or sampling kits where you take a sample and send it off to them and they'll analyze it. But really, if you're going to do that, you want to be speaking to an expert who can then help advise you depending on what's found. So rather than just doing a DIY one, it's probably better speaking to a functional medicine. They're not all doctors. There are some other healthcare professionals who've done functional medicine training. So there could be physios or nurses, pharmacists who've done extra training in functional medicine. And there are more and more of them popping up around the country now. But unfortunately, you know, there is a cost attached.
Going back to the apple cider vinegar, when is best time to take it? At night before bedtime?
Oh no, I wouldn't do that. I would take it. Some people swear by taking it first thing in the morning. Others, for the same reason, would take some lemon juice in hot water before in the morning. But from the diabetes point of view, it's a little bit before each meal, just before you eat. Which might help with the indigestion, because it's taking it on an empty stomach that's hard for some people. So if you take it literally as you're about to eat, then the food will help to offset that acidic feeling that you get if you don't tolerate it well. But definitely I wouldn't take it, especially if you've not eaten for a few hours before you go to bed, because if it does upset you, then it's going to disturb your sleep.
Yeah.
There's a question here that says, can we make oregano or thyme oil by infusing these herbs in olive oil?
I dare say you can. I honestly am not an expert enough to know what concentration you need for it to be beneficial. So I've only used, I've taken a course of capsules that got oregano and thyme and turmeric in them, and it's really helped my gut. I would imagine they're quite concentrated. So if you just want to do it so that you've got something that again is adding to your meal, so you're going to use that perhaps in a salad dressing or something, then it all helps to enhance the food you're having, then absolutely fine. But if it's to actually address a current acute issue, then I couldn't advise you on what concentration you needed. So but I think, you know, it's really good reminder that all these wonderful herbs and particularly leafy green vegetables can actually have lots of medicinal uses, and turmeric is particularly useful as an anti-inflammatory. I was listening to something today that pointed out that for people who are vegetarian who don't eat meat, red meat particularly, where a lot of us get our iron from, and you rely on green leafy veg, particularly things like spinach, you need that acid in your stomach to help you break down the spinach to get the iron out of it. So this comes back to our discussion about reduced acid in the stomach. People believe they're eating things that will be nutritious for them, but they may not actually be getting the amount of nutrition they think if they're on a PPI or whatever. So
it reduces the bioavailability, doesn't it? So your body, it's not available to your body, even though you're having it.
I mean, that acid is in the stomach for a reason. And, it goes back to modern medicine has sometimes forgotten why some of these things happen. And yes, we need to, if you've got a stomach ulcer, I mean, gosh, when I was working in the hospitals in the 1970s, we had loads of people coming in for surgery for gastric ulcers that you hardly ever see now, because we do have the PPIs that help the stomach to recover from that ulcer. But as I said, you were never meant to be on them permanently. It would be more about addressing what caused that ulcer in the first place from a diet or lifestyle point of view, and trying to prevent it happening again, rather than just slamming somebody on a drug that's going to stop their stomach acid forevermore. Sourdough bread, I think I saw something there.
I haven't seen
that. Sourdough is definitely better than traditional bread, because it is fermented yeast that's used to sort of start the dough up, the mix. But I would just say that it's still carby. So if you're trying to be low carb, sorry, it's bread.
Bread is
at the end of the day, if you're going to eat bread, it's probably the apart from the low carb breads that we're talking about, it's the better of the two. But again, for high days and holidays, I wouldn't be having that every day, because the little bit of benefit you might be getting from that nice starter that is a fermented product, you've got all the carbs in the flour that the bread was made out of. So I think probably one, cancels out the other. So it's not a panacea for sorting out your gut. Somebody said maybe stop coffee. I think maybe that's addressed to the person that can't give up sugar in the coffee, and I suppose that is one solution. A small amount of coffee every day is thought to have some beneficial qualities. So, if you like your coffee, I would just try to persist in giving up the sugar. But if you think you're addicted, then that's not a great idea. So there's lots going on there.
Somebody's asking, what is the microbiome?
What is the
microbiome? What is the microbiome?
The microbiome is what we've been talking about all evening, which is the collection of organisms that live. I've been talking principally about the gut, where the vast majority, I think we reckon about 80% of the microbiome is in our gut, but we are colonized by organisms all over. I used to show a slide when I used to teach about immunity, that showed how many organisms you had per square inch of skin, per gram of saliva, disgusting, but per gram of nasal fluid on your scalp. And I mean, there are hundreds of thousands of these organisms all over us, and they are there principally to protect us from invaders. So most of them are good. It's just when we get out of the sort of the circle of life, if you like, where the balance is disturbed, that some of them can do us harm. So the microbiome is just simply a word really for a collection of the microbes that live mostly happily with us.
Also, could I add that depending on the gut microbiome that we have, that can really influence our choice of food.
Yes, thank you. There's so much to say. We could probably do about 3 of these and still not cover the whole of the microbiome, but absolutely, that was the point I meant to make when I was talking about sugar encouraging the bad bacteria. So if you have a very high sugar diet, it encourages growth of the bad bacteria, and they have a sort of feedback loop, if you like, to the brain. So they keep the hunger request going. So they do it. It's all part of what we've discussed before, is that when you eat a lot of sugar, you get these sugar, these crashes because you get insulin released and it drops your blood sugar and then you need more, but also you're getting this these signals from the gut as well, because the bad bacteria are screaming for more sugar. But also, if you are eating a lot of things that are not nutritious, and particularly that don't contain protein, your body needs protein to thrive. Protein gives you the amino acids, which are the basic building materials for every body cell. And if you're not taking in enough of those in whatever way your meals are balanced, your body will keep telling you to eat, because it wants you to keep eating until you've eaten enough protein. And if you're eating a very poor protein diet, then you will be ravenous and you will keep eating. So all of this is sort of interlinked, we need to be mindful again as to why we're eating, and we should be eating to fuel our body, not to, just because we fancy a cake. And I'm thinking about what the components of our food are, and is it just sugar that I'm taking on board, or am I actually taking something that's going to give nourishment to my body?
Yeah, so that's where the term overfed and undernourished comes
Absolutely.
from.
Absolutely. And that, unfortunately, is what an awful lot of us with the modern Western diets are.
Yeah. Nishila's just commented, but eating is so good.
I
Absolutely.
know.
It gives us so much joy.
It's become that, though, because we've been introduced to combinations of food that are so Moorish. Now, our forefathers would have just eaten what was available, and there wouldn't have been a massive supply anyway. But also, it wouldn't have had those combinations, and you would have eaten and stopped eating once you were satisfied. But a lot of the foods we have now, we're never satisfied, because they produce this cycle of want. We've also developed a lot of habits where we eat because we're watching the telly, or I went to the cinema. We go to the cinema once every 6 years when the last James Bond has just come out, because that's what my husband wants to see. So I was at the cinema a couple of weeks ago watching the latest James Bond, and again, I'm just there with my mouth open, because the things of popcorn are this big now, the bags of sweets are this big, the things that the cola goes in. And that's the way people associate going to the cinema with having these things. And it's just unfortunately got out of hand. I mean, we didn't have any, by the way, but even if we did, once every 6 years isn't going to kill us. But if people are doing this every day or every week, then these are all the things that are contributing to us being the shape that many of us are, unfortunately.
We've got a question that is, what is a diabetes rewind program? Have you heard of it?
I think it's reverse diabetes.
I think there are a number of things out there that the NHS are offering, which are not quite in line with what we talk about. They still tend to encourage more carbohydrate than we would. But there has been some improvement. There is one NHS thing. I wonder if that's... I don't know is the short answer. We'll have to have a look at that.
I'll just quickly Google it
next time. Okay. Because there are one or two things that some PHC ambassadors who happen to be practice nurses have got involved with, which have got much better information. Yeah, I would just say to Nishila that I don't want to sound like I'm a killjoy, because eating should still be enjoyable. We want you to enjoy your food, because we want to be mindful about eating and and we should sit and enjoy our food and concentrate on our food, not be eating while we're doing other things. And you can still have really tasty, nutritious food, as long as it's real food. So, find lots and lots more new recipes, and we should be, in order to really feed our microbiome, we should be eating a great diversity of vegetables. I think we can all be guilty in busy lives of knowing what we know and having a few favorite recipes and a few favorite veg and eating those nearly all the time. And we really should try it, maybe set ourselves a challenge of every week seeing something in the shop that we haven't tried before and giving it a go. And with the wonderful internet now, you can find recipes for these things and how to cook them so easily. And they talk about eating a rainbow, you know, so don't just stick to green leafy vegetables, but highly coloured vegetables have often got a lot of great nutritional content. We just encourage you to be sparing with the root veg that are the more carby. But, you know, once in a while they're fine too. But really be experimental and try with the wonderful wide variety, although preferably seasonal vegetables that haven't had to travel halfway across the world. You know, be adventurous and make food fun. You had a keto pizza. You haven't had the right keto pizza if you think it wasn't as good as the real thing, because there's some great keto pizza recipes. So maybe we need to share some of those that can be as good as the real thing.
If I can interrupt, I've just had a quick look at the Rewind program. Now, they've got two options. They've got the total diet replacement, which is the low calorie replacement for food. Or for those who don't want to do the replacement, they do have a low carbohydrate choice. But what that entails, I have no idea.
And who does it look like? It's NHS or is it?
I think it's kind of NHS. Yeah, it says NHS North London on this site that I've clicked onto in the corner.
Okay. Right. Well, we would support it if it's low carb. I would always urge caution with these meal replacement shakes ones, because they don't teach you how to eat for the long term. And you know, lots of people can lose a lot of weight very quickly doing meal replacements, but the problem comes when they stop that program and they've got to learn to eat healthily and not undo all the good that they've done with that sharp sort of shock bit. You can lose weight quite quickly and reverse diabetes quite quickly just using a low carb approach. So I would always encourage you to try and go down that route first, because that way you start to hopefully pick up good habits and learn new ways of approaching food that you can carry on with.
Yeah, I definitely think that is a better way, because the total diet replacement, the meal replacement, it says it's only about 800 calories daily, which then means your metabolic rate will adjust and slow down. So when you do reintroduce food, you'll just put weight back on. So that's the sort of yo-yo dieting where people will lose weight and then end up putting on more weight back on, because you've got to think of this as a lifestyle, not a diet. It's not short term.
That's exactly the point, you know, and that's why I really get frustrated with the shake approach. You know, I know Michael Mosley, the doctor that does a lot of work on the telly, and he's done quite a lot of different diet programs, and he sells on his website now, sells some of these meal replacements, and I hear them justifying them by saying, well, you know, there are some people who are very busy and they go to work and it's difficult for them to take a healthy option with them, and I kind of understand that to a degree, as long as people understand what and why they're doing it. As a, you know, if you can't make lunch at work, and taking a sandwich obviously isn't what we'd recommend, then a shake might be appropriate. But I would always go for trying to use real food first and learning how to manage food, because that's going to be sustainable, whereas anything that's kind of artificial, apart from which, if you look at the ingredients on all of these shakes, they're far from wholesome looking. And therefore I would always go with real food wherever I can.
Well, I think sometimes this would also lead to comfort eating, like fresh cream cakes.
How do you mean? The
going on a diet, and then somehow you come flagged out and say, oh,
blow
I'm going
it.
to
Yeah.
pressure
Well,
intakes.
that's the problem. If you let yourself get hungry, you're going to
Yeah.
give into that kind of temptation much more easily. Whereas we would say on a low carb approach, because you're eating healthy proteins, well, protein is always healthy, protein and healthy fats, with a minimum amount of carbohydrate, you shouldn't be starving hungry. That's why if you do feel, if you had a good meal and you still feel that you're hungry before your next meal, that's when you have to ask yourself some questions about, do I think I'm hungry, or am I really hungry? Am I thinking it's just because it's 4 o'clock and I always used to have a cup of tea and a biscuit at 4 o'clock, and now I'm telling myself I can't have that? You're not actually hungry. That's just the habit you're trying to break. But if you're eating real food at the meal times, it's much easier to have those conversations with yourself. Whereas if you're depriving yourself and you are genuinely hungry, then you're going to give in much more easily.
Well, okay, so is this part 1 or part 2 going to follow?
Well, it depends. Depends what people want. I don't think I'm going to be able to do another one of these until well into December, because I'm busy now for 2 weeks, then I'm going away for 2 weeks.
Wow, where are you going?
I'm going to Austria skiing.
Oh,
Going to the mountains.
very
I
nice.
was denied my skiing last year, so we were denied our skiing last year, so we're going for 2 weeks. So I don't know how interested people will be in one on the 21st of December.
21st of December. Probably
Not good.
not good for me.
Yeah. So I will be back on the 14th, but I'll only just be back, and I really don't feel I'll have time to do something worthwhile. So I don't know whether.
Shall we have a break till Christmas now?
Yeah, into the new year.
To the new year.
Do you want to put, say, the 4th of January? Start the new year off with a. Well, I know you've just had your new year, but our new year, the other new year, started off with some good intentions.
Yeah, 4th of January would be fine.
Is that fine? How about you, Doctor?
Yeah. 4th of January will be fine. I think at the moment it's not showing up as.
Yeah.
Okay. So are we going to have 2?
Is anybody online today got ideas of what they'd like to hear about?
Let me just unmute everybody. Guys,
Sorry, before we look at the topic, you may have answered my question and I missed it. Does having apple cider vinegar give you constipation? Because somebody mentioned that, and since they mentioned it, I stopped having it.
Well, we did mention that. We did answer it, but neither Dax or I can think of a reason why it would. I really don't. I cannot think of a physiological reason why it would cause that. Different people, don't forget, people are all very, very individual with a lot of these things. But the only common problem I know associated with it can cause some people heartburn because it is acidic, and therefore they just can't tolerate it, and they do better with the capsules. But I cannot think of we're only talking about taking a tablespoon or so in a glass of water, either before each meal or once in the morning. And I cannot think of a reason why it could possibly cause constipation.
Okay, thank you.
A quick Google search has just said that actually it should ease constipation.
Yeah.
Yeah, some people claim that apple cider vinegar can ease constipation.
I was going to say that actually, because a friend of mine swears by it. She says that she actually takes it every morning and it helps her.
Yeah.
Yeah, could it be a replacement for lemon then? You know, if you take lemon and honey, could you instead take apple cider vinegar?
Yes. Yeah.
Yeah.
But I wouldn't take a cup of neat vinegar. I would a tablespoon dissolved in a cup of water.
Yeah.
But I mean, the lemon juice is good too, because the lemon juice has got its own properties. But either or, But if you're diabetic, then I don't know of any research on lemon juice, but I know that there is research that shows that apple cider vinegar can help with blood sugar control.
Okay, thank you.
So anybody got any burning topics that they'd like us to start the new year off with? Deathly silence.
It would be nice if everybody had their videos on instead of, we speaking to each other. That's how we feel, and not to our participants.
I personally would love to hear how everyone's getting on and what changes they've made, and a little bit of sharing to encourage others to try things. It would be great if everyone could come along.
That's
and
good.
say
Yeah.
something, about how they. Well, one thing at least that's working for them. Mayuri's raised a hand. I don't know.
Mayuri, speak.
Oh, somebody said portion control, protein.
Actually,
Well, go on.
no, so I was going to say, I would also like to understand how, because I'm supposed to be eating 80 grams of protein, and I really struggle being a vegetarian and on low carb to get it. So it'd be quite interesting to see if you could cover that in your next session, perhaps.
So should we maybe have a focus on protein?
Okay.
But I agree with that. So I mean, I do an awful lot of talking on these evenings, and it would be lovely to hear from some of you. What's going well, what's not going well.
I think we should
So
hear.
shall I do just a little bit on protein and then mainly have an open session where people can, share their feelings, their experiences.
I think that's a good idea. You talk a little bit of the protein subject, and then we ask each participant to talk about themselves, how they're doing with this talks we've had for the past months.
Yeah, what they find easy, what they've struggled with, Yeah,
I think it's a good idea. That way we can also see your faces on the video. We don't want to talk to blank screen, so we can talk to the faces. Yes, Ranjuman, talk. You can unmute.
Caroline, can you give me an advice which is the best protein to take? Protein powder.
Protein powder?
Yeah, with this cereal, like for breakfast.
What are you having for breakfast?
Berries, little bit of fruit, thick yogurt.
Yeah, well, you'll be getting some protein in your yogurt. I think adding some seeds and nuts is probably the best thing. The protein powders that you can buy are good to supplement, but I wouldn't want to be relying on them all the time. Again, the real food is better. So could you add some seeds or nuts to the yogurt and berries?
Yeah, yogurt and berries, and the seed mixture which you recommended, I made that.
Yeah.
So
well, that's fine.
Is that enough for breakfast?
Well, that's again down to how do you feel? Does that keep you going until lunchtime?
No, till evening meal. I don't have any lunch then.
Sorry?
I just have brunch. I don't have any breakfast. I just have.
Right, so you're just doing 2 meals. Yeah. So is that enough? I mean, do you eat eggs?
No, I don't. No.
So it's really for you to decide, is that enough? Is it satisfying you until you have your next meal?
It is actually. I don't feel hungry before that time.
Yeah.
Then just before.
After you've had it, are you okay then till you have your main meal?
Quite well. I feel quite full with it.
Yeah. I would think that that's doing a good job then.
And I have a couple of herbal teas in between. I don't have tea, coffee.
Yeah.
No sugar.
So I think it's important then to concentrate on what protein you have in the next meal.
Yeah, I have some sort of dal every evening, no rice, and a big bowl of salad and vegetable curry.
And again, you can sprinkle some seeds and things on that salad as well.
Yeah.
You know, sesame seeds and, you know,
Salad.
yeah.
Yeah.
So, you know, just keep remembering to sprinkle seeds on things. Just to,
Yeah.
it helps.
Okay. And I'm quite satisfied with that. I don't
Yeah.
eat anything else. No nasta or nothing. No fried,
Good.
no sweet. Nothing.
Well, I mean,
fantastic.
nuts are a very good source of protein for vegetarians, particularly if you're not eating things like eggs. So toasted nuts are lovely, chopped up on salads, or again added walnuts and things like that. Toasted can be added to your yogurt in the morning, but it could be added to some of your evening meals just to get that extra little bit of protein in.
Okay.
But you know, if you are feeling satisfied, that's
I
reasonably good.
idea. Yeah.
Caroline, I just
Hello?
wanted to, hello. I listened to an Ayurvedic talk the other day, and they were saying we must not be mixing yogurt with fruits. It's a bad combination from Ayurvedic perspective.
Pass. That's
Yeah, no, I don't know. I think maybe it is. I don't know, because you've got is it the dosa or something? You know.
Yeah, you have different dosas. Yeah. And
Yeah.
you work with that. Yeah.
Yeah, you work with that.
Yeah.
So I don't know a lot about that. I'm sorry. But you could read about it maybe and see what you uncover and what the reasons are, and you know, is that only if you're a certain dosa and you're not always a certain dosha all the time? I think it varies, doesn't it? I think we can move from each of those.
Yeah, okay, I'll check it out. Thank you.
Yeah, I'm sorry.
Unfortunately, there are, you know, an awful lot of different approaches to food, and they sometimes contradict each other. But I can't think of a biological reason why you can't have those two things together.
Because I mean, if you think about lassi, you know, if it's mango lassi, I don't know if that's a traditional drink or if that's a Western invention, which is yogurt with mango, and you know, you get it in all the restaurants. That's fruit and yogurt. So, but then it could just be one of these things that they've created because it does, you know, make you want more and more.
Well, I think when it's all blended, and especially if they add sweetness. I mean, mango's sweet anyway, but
yeah, exactly.
I mean, obviously, we don't encourage the fruit yogurts that are produced in the UK, but what we suggest is the whole berries with the natural yogurt.
Yeah, that's what I have. Yeah.
Yeah, and you know, I don't understand a biological reason, but I'm afraid I'm not an expert on the Ayurvedic principles. But I can't think of a biological reason why it would be bad. So
Mayuri has a question.
Yes, I don't know what you think of the topics I suggested for January 2022. The aging process, how to age gracefully, prevention of falls and accidents and things.
Well, our approach is obviously nutrition. I can't talk about the other aspects, but certainly the nutrition we could look at, because we are going to be talking about protein, and protein is ever so important. As you get older, you do actually need more protein as you're getting older. So I can certainly look at the dietary side of aging.
Yeah, okay, fine. Yeah.
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 Yes, I think that would be good, added with, you know, like the essential minerals and vitamins we should be taking as we age, because our body is not as effective. So we need some essential things.
Okay. Right, well, I think we've probably got enough for the first one, but please do remember we're expecting some of you to have a chat as well and tell us how you're doing.
And how you've navigated Christmas.
Yes. Oh heck, 2 holidays and Christmas. It's not.
Yeah.
I was explaining.
I might have my video off.
It's helping me a lot, Caroline, because I've stopped all the sulfadine which I was taking. The strong painkillers, and from 10 milligram pressure tablets I've gone down to 5 milligram.
Excellent.
Wonderful.
So, that's not bad actually.
No, it's excellent.
Yeah.
And can I just sort of say, in the new year, if you've got any friends and family, please encourage them to come along to the sessions. You know, you can share how well you're doing. You know, the more people we get the message to, you know, that eating a low carb diet helps, it would be fantastic. You know, we'll all be doing our little bit.
Absolutely.
Absolutely agree.
Yes. Okay, ladies and gentlemen, if there are any, we look forward to meet you on the 4th of January.
Yes.
And I hope not many of you will be landing with so many turkeys and pies and everything. You're really going to spoil your diet, but like me,
turkey's okay, just be careful what goes with it.
yeah.
Okay.
Then we really have to diet seriously and smack up ourselves.
It's a good week to start. Get the good intentions going nice and early in January.
Absolutely,
Okay.
absolutely. Anyway, I was just thinking, before we all leave tonight, can we just give one of our women to women, only 55 years old. She died all of a sudden, and we are devastated by hearing her news. So can we give half a minute of silence for her, that she rest in peace? So,
absolutely.
Yeah, can we just wait in silence, please? Shanti, Shanti, Shanti. This is Divya Patel behind me. Only 55 years old. She actually was in the Mela last week, Sunday, met up with lots and lots of women to women ladies, had lots of fun, and she's a happy-go-lucky girl, always bubbly and laughing and making friends with everyone. And next thing we hear that she's gone.
Oh,
and
gosh.
She left us on our New Year's Day. Sadly, family is very devastated. We don't know what to say as well, because she's been with us for 4 years, and she was a very, very active person with all our functions, live functions, and we're going to miss her now. Don't know what to say. Everybody's out of words for her. But we've been praying for her, that she rest in peace and be happy wherever she is. So anyway, thank you very much, everyone. And we wish you all a happy Christmas, and hope to catch up on 4th of January. I will definitely look after myself. So please, you look after yourselves. Don't overindulge yourself with the cakes and sweets. And take care all. We shall catch up on the 4th of January. Thank you very much. And with the new year coming, we would like to see all the faces. No more videos closed. So we'd like to see all the faces. We'd like to speak to the faces. We'd like to learn who these faces are. So that will be nice. So we'll catch you up on 4th of January. Have a lovely, lovely holidays, as Americans say.
You.
So
Thank you,
take
Panna.
care all, and you enjoy your skiing. I'd like
I'll
to
do my
go-
best. Thank you.
Have a lovely skiing as well, and catch up with you soon.
Yes,
But
look
I
forward to
know
seeing you then.
we will all keep in touch on WhatsApp and discuss more things if we needed to.
Yeah.
Thank you very much all.
Are you going to send the recap of today's, what we discussed?
Yeah.
Yeah, thanks.
Panna will send the link.
Okay, thanks.
Okay.
Thank you very much again. Take care all,
Thank
and
you.
Okay.
wish you Merry Christmas too, and Happy New Year. Have a Diwali as well. So some
And
about
to all of you.
Thank you. Thank
Thank
you.
you.
Take care all.
Bye.
Take care.
Take care.
Bye-bye. Bye.
Bye.
Bye.